When it comes to managing diabetes, most people immediately think of blood sugar readings, diet adjustments, or maybe insulin schedules. But one of the most overlooked aspects of care lies much farther down, at your feet. It sounds almost too simple, but the truth is this: the health of your feet can tell a much bigger story about the state of your body than you realize. And for those living with diabetes, something as ordinary as a blister or a small cut can escalate into a crisis if left unnoticed. That's why daily inspection is not just a recommendation, it's a lifeline. Now, let's pause and think about why the feet are so vulnerable in the first place. Diabetes, especially when not carefully managed, can damage nerves, a condition called neuropathy. This means you might not feel pain the way you used to. Imagine stepping on a small piece of glass or developing a blister from a tight shoe, and you don't even realize it's there because the nerves aren't sending clear signals. Without that natural alarm system, tiny injuries can quietly worsen. Add to that the fact that diabetes often reduces circulation, slowing the body's ability to heal, and you have the perfect storm for complications. A minor scratch could turn into an ulcer, and an untreated ulcer could lead to infection, sometimes even amputation. All of this begins with something as small as what you don't see because you weren't looking. That's why making daily inspection a habit is more than a medical guideline. It's a mindset. Think of it as an act of respect toward your body. Every evening, before you settle down for the night, give yourself 2 minutes to look closely at your feet. It doesn't matter if you're flexible enough to bend and check yourself, or if you need a mirror or even a loved one's help. What matters is that you make it part of your routine, as automatic as brushing your teeth. Because every day you check, you're not just preventing an injury, you're taking control of your health in a very tangible way. And let's be honest, many seniors, even those without diabetes, tend to ignore their feet until something goes wrong. Out of sight, out of mind. But ignoring the feet is like ignoring the foundation of your home. You don't notice the cracks until suddenly the whole structure is at risk. Your feet carry you through life, step after step, year after year. And when diabetes is in the picture, they deserve even more attention. There's also a deeper psychological layer here. Daily inspection is not simply about hunting for wounds. It's about cultivating awareness. It teaches you to stay present with your body, to pay attention to the small details before they snowball into major issues. This act of self-checking becomes a ritual of mindfulness. You remind yourself each day that prevention is always more powerful than treatment. You're telling your body, I see you, I care for you, and I won't let small problems slip by unnoticed. And think about the peace of mind it offers. For many people with diabetes, anxiety about potential complications can feel overwhelming. But when you check your feet daily, you give yourself reassurance. You don't live in the uncertainty of, what if something's happening and I don't know it? Instead, you take control of the unknown, and that sense of empowerment reduces stress, which in turn helps your overall health. Let me share something I've observed in countless patients. Those who build this habit often avoid the kinds of hospital visits that others face. The difference isn't always in medication or technology. It's in simple, consistent self-care. I've met seniors who proudly tell me, I've been checking my feet every day for 10 years, and I've never had a serious issue. That isn't luck. That's discipline. That's prevention working exactly the way it should. So how do you start? The best way is to anchor the habit to something you already do. Maybe it's right after your evening shower when your feet are already clean and visible. Maybe it's before you slip on your socks in the morning. Keep a small mirror nearby if it's hard to see the bottoms of your feet. If bending is difficult, ask a partner, a family member, or even a caregiver to assist. What matters most is not how you do it. It's that you do it. Some might say, it's just 2 feet. How much difference can it make? But here's the truth. The difference could be between walking comfortably into your later years or struggling with complications that steal your independence. For a senior, mobility is freedom, and freedom begins with healthy feet. So tonight, when you sit down, take a moment to look closely. Don't dismiss it as routine or trivial. See it for what it really is, an act of self-respect, of vigilance, and of love for the body that has carried you all these years. Because sometimes the smallest daily actions are the ones that protect us from the largest dangers. And here's the reflection I'll leave you with in life. We often search for big solutions, but it's the quiet, consistent habits that shape our destiny. If checking your feet for 2 minutes a day can save you from months or even years of suffering, isn't that the kind of wisdom worth living by? Prevention is not passive, it's power. use it. Moisturizing the feet may sound like a simple cosmetic habit, something we do to keep the skin looking nice or feeling soft. But for someone living with diabetes, this small act carries profound importance. The skin, after all, is not just a covering, it is a living barrier, a guardian that stands between your body and the outside world. When it becomes dry, cracked, or neglected, that barrier is broken. And for diabetics, that break is not just about appearance, it's an open invitation to infection. Now, let's think about why this matters so much. Diabetes, as we know, changes the body in subtle but powerful ways. Circulation is often weaker, which means the skin on the feet doesn't receive the same nourishment, hydration, and oxygen as it once did. Combine that with nerve damage and the natural protective responses like noticing dryness, itching, or irritation don't always function as they should. What starts as a tiny fissure in the heel can become the entry point for bacteria. And when the body's healing is already slowed by diabetes, that small opening can spiral into something far more serious. Moisturizing daily then is not about vanity. It's about protection. It is the difference between a strong, resilient barrier and one that is vulnerable to attack. When you take a moment to apply lotion or cream to your feet, you are strengthening that shield. You are reinforcing your body's first-line defense, making sure that dryness does not lead to cracks, and cracks do not become ulcers. This is a chain reaction we can stop at its earliest stage, before it even begins, by committing to a habit so small it hardly takes a minute. But let's also step back and view this on a deeper, more philosophical level. When you moisturize your feet, you are engaging in one of the most humble acts of self-care. It requires you to pause, to touch, to acknowledge a part of your body that most of us overlook. In our culture, we tend to think of self-care in grand gestures, spa days, vacations, special diets. Yet the truest form of care often comes in these small, repeated actions. It's in the consistency, not the extravagance. Each time you rub moisturizer into your feet, you're not just preventing cracks. You're communicating to yourself, I value my body enough to tend to its smallest needs. And that mindset spills over into everything else, how you eat, how you move, how you live. Of course, not every moisturizer is equal when it comes to diabetic feet. It's important to choose creams designed for sensitive or dry skin, those that hydrate deeply without leaving excess moisture between the toes. Why? Because too much dampness in those areas can actually invite fungal infections. The trick is balance, keeping the skin supple and strong without creating an environment where bacteria or fungi thrive. Even in this, there's a lesson. Health is rarely about extremes. It's about finding that careful middle ground, that harmony between too much and too little. And there's a practical benefit as well. When you make moisturizing part of your routine, you naturally spend a little more time observing your feet. As you apply the cream, you notice if the skin is irritated, if a blister has formed, or if a spot looks unusual. The very act of moisturizing doubles as a mini inspection. You become more in tune with the condition of your feet, often catching small issues before they become emergencies. Prevention is built into the practice like a bonus gift hidden within the habit. I've seen firsthand how powerful this small step can be. Patients who commit to moisturizing often avoid the painful fissures, the slow healing ulcers, and the costly interventions that others face. Their skin remains intact, strong, and far less prone to complications. What amazes me most is that this protection doesn't require a new prescription, expensive technology, or complicated treatments. It requires only mindfulness and a bottle of lotion. And sometimes, the simplest solutions are the most profound. But perhaps the greatest value of this practice lies in the message it gives to the one doing it. To pause each day, even for a moment, and care for your feet is to affirm that your health matters, that prevention is worth your time, that your body deserves your respect. And if we're honest, many of us forget that. We push through life, tending to everyone else, and only look at our own needs when something breaks down. Moisturizing then becomes more than a routine. It becomes a philosophy, care for what you have so that you can continue to stand, walk, and move through life with strength. So the next time you reach for that cream, don't think of it as a trivial act. Think of it as armor. Think of it as gratitude for the feet that have carried you this far and an investment in the steps you still have ahead. Every rub, every stroke is a promise to yourself that you won't take your body for granted. And here's the reflection I'll leave you with: the choices that protect us most are rarely dramatic. They are quiet, consistent, almost invisible to the outside world. Moisturizing your feet may not seem like much, but it could mean the difference between comfort and pain, between freedom and limitation. Protect the skin that protects you. because health is not maintained in grand moments. It's built in the small ones, repeated faithfully day after day. When it comes to caring for diabetic feet, trimming toenails properly may seem like one of the smallest details. It's the kind of task we take for granted, one we rush through, or maybe even ignore until the nail becomes uncomfortable. But for someone living with diabetes, toenail care is anything but trivial. It's a line of defense, one of those quiet yet powerful habits that can mean the difference between healthy feet and painful complications. Why does something as ordinary as trimming nails matter so much? Let's start with the basic truth. Diabetes changes how the body heals. Even minor injuries take longer to recover, and infections are harder to fight off. Now imagine trimming a toenail too short, cutting into the skin, or leaving behind a jagged edge. On healthy feet, that might result in a little tenderness for a day or two. But on diabetic feet, that small cut can become the spark that lights a fire, a slow healing wound, an ingrown nail, or worse, an infection that burrows deeper than anyone expected. That's why precision matters. It's not enough to simply clip the nails. They need to be trimmed straight across, not curved at the corners to avoid digging into the skin. They need to be cut short enough to prevent pressure inside shoes, but not so short that the delicate skin around the nail bed is exposed. It's a delicate balance, and it requires patience. Rushing or neglecting this step is like leaving a door cracked open for trouble to walk in. But there's something deeper here as well, something psychological and even philosophical. Caring for your toenails is an act of respect for your foundation. Think about it. Your feet bear the weight of your entire body, step after step, mile after mile. They are your anchors to the earth, the very tools that carry you toward your goals. And yet, because they're so far away from our eyes, they're often the most forgotten. Trimming toenails properly forces us to pay attention to this foundation. It calls us to bend down, to look closely, to give time and care to a part of ourselves we rarely notice. This act also invites humility. There's nothing glamorous about trimming toenails, but perhaps that's the point. Health isn't sustained by glamorous acts. It's built through quiet, humble routines. Just as brushing teeth protects from decay, or washing hands shields us from illness, trimming toenails in the right way shields us from problems we may never see coming. It's a reminder that prevention always starts with the small things, and those small things ripple outward into larger health outcomes. For many diabetics, however, this step isn't just about knowledge. It's about empowerment. Some people feel uneasy managing their toenails on their own, whether because of vision problems, limited mobility, or fear of making a mistake, and that's okay. In those cases, seeking help from a podiatrist isn't a weakness, it's wisdom. It's recognizing that protecting your health sometimes means calling on someone else's expertise. That decision, too, is a form of self-care, one that says, I am worth protecting, even if it means asking for help. And here's where the conversation becomes larger. Toenail care isn't just about avoiding ingrown nails or infections. It's about building awareness. Every time you trim your nails, you have the chance to look at your feet, to notice changes in color, swelling, or shape. You catch things early before they have the chance to grow into something serious. What begins as a grooming task transforms into a ritual of observation, of mindfulness. You become your own first line of defense. I once had a patient who dismissed toenail care as unimportant. He rarely looked at his feet and let his nails grow long. One day, a nail dug into his skin, created a sore, and by the time he noticed it, the wound was already infected. That small act of neglect ended up requiring weeks of treatment. What struck me most wasn't just the physical cost, it was his regret. He told me, if I had just taken a few minutes to clip my nails properly, all of this could have been avoided. His words echo what so many eventually realize: the smallest habits often have the greatest consequences. So trimming your toenails isn't just about hygiene, it's about foresight. It's about acknowledging that your health depends not on once innate, wild grand gestures, but on consistent, thoughtful actions. It's about taking ownership of your well-being one small step at a time. And maybe, on a deeper level, it's also about honoring your journey. Your feet carry you to work, to your loved ones, to the places where your memories are made. Caring for them by trimming your nails correctly is a way of saying thank you to them, of making sure they can carry you through the chapters still ahead. So the next time you sit down to trim your toenails, don't think of it as a chore. Think of it as a ritual of care, a quiet investment in your mobility, your independence, and your freedom. Because in the end, the things that keep us moving forward in life are not always the dramatic choices. They are the subtle, consistent ones. And here is the reflection I want to leave you with. A toenail is a small thing, but the way you care for it can determine the course of your health. Never underestimate the power of these little acts, because when it comes to protecting your future, the smallest details often hold the biggest weight. When we talk about diabetic foot care, there's one simple habit that often makes the greatest difference: choosing the right shoes and socks. At first glance, it sounds so basic, almost too obvious. But the truth is, footwear isn't just fashion, it's protection, it's prevention, and for people living with diabetes, it can mean the difference between comfort and crisis. Your shoes are not just what you walk in. They are your daily guardians, the shield that separates your vulnerable feet from the unforgiving world beneath them. Diabetes changes the way the body experiences sensation. Neuropathy, or nerve damage, dulls the signals your feet normally send to your brain. That means something as small as a pebble in your shoe, a seam in your sock, or the tight edge of a shoe rubbing against your skin can go unnoticed for hours, even days. But while you may not feel it, your skin does. That friction, that pressure, that unnoticed injury is quietly working against you. And because healing takes longer with diabetes, that small irritation can quickly spiral into an ulcer, an infection, or worse. All because of the shoes on your feet. This is why the choice of footwear must shift from style first to safety first. Shoes should fit comfortably, not tight, not loose, but snug in a way that protects the foot without compressing it. Wide toe boxes are essential because squeezing toes together only invites blisters and ingrown nails. Breathable materials matter, too, allowing air to circulate and moisture to escape, because dampness is an invitation for bacteria and fungi. And as simple as it sounds, always checking inside your shoes before slipping them on can save you from hours of hidden harm. Sometimes it's the overlooked pebble, the forgotten tack, or the folded sock lining that does the damage you never see coming. And let's not forget socks, the silent partners in this equation. Diabetic-friendly socks are not a gimmick. They are a necessity. Seamless, cushioned, moisture-wicking fabrics prevent irritation and reduce the risk of fungal infections. They don't constrict circulation, which is vital for someone already battling reduced blood flow. Wearing the wrong socks may seem harmless, but it's often the smallest points of friction that open the biggest doors to complications. Socks may be thin and quiet, but in this story, they're as important as the shoes themselves. But beyond the practical, there's a deeper truth in this discussion. Choosing the right footwear is symbolic of the way we choose to walk through life. Every step we take is a reflection of the foundation we've prepared for ourselves. Just as the wrong shoes can quietly injure, the wrong daily choices about food, about rest, about care can quietly erode our health. And just as the right shoes can protect us without us even noticing, the right habits can carry us forward without struggle. This is not just about protecting feet. It's about recognizing that preparation determines the quality of our journey. I once spoke with a man who brushed off the importance of footwear. He wore old, tight shoes simply because they were convenient. Over time, he developed a sore on his toe that he didn't notice until it became infected. What followed was weeks of treatment, hospital visits, and a deep sense of regret. His story isn't rare, it's repeated far too often, and it always comes back to the same lesson. It's not the dramatic injuries that catch us off guard, it's the little ones we thought were harmless. That's why caring for your footwear is not vanity, it's vigilance. It's saying, I value my mobility, my independence, and my future enough to protect it at the ground level. Every time you put on the right shoes and socks, you're not just getting dressed, you're making a decision to preserve your freedom, your ability to walk where you please, to remain active and engaged in life. And here's the beauty of it, this is a choice fully within your control. You don't need advanced technology, expensive treatments, or complicated routines. You simply need awareness, consistency, and the willingness to prioritize protection over appearance. You have the power to take control of your health in the most practical way, step by step, shoe by shoe. Think about it this way. Our lives are built on journeys, literal and symbolic. We walk into new opportunities, new relationships, new chapters. But those journeys are only possible if our feet can carry us. Protecting them isn't just about health, it's about preserving the freedom to keep moving forward in life, unrestrained, unburdened, and unafraid. So the next time you tie your laces or pull on your socks, pause for a moment. Recognize that what you're doing is not ordinary, it's extraordinary in its simplicity. You're safeguarding your future one small choice at a time. Because when it comes to diabetic feet, protection is not found in grand gestures, but in daily diligence. And here's the thought I want to leave with you. Your shoes are not just coverings for your feet. They are guardians of your independence. Choose them wisely because every step you take is a step toward the life you want to keep living.